You're here. Welcome to my clinic. I'm just reading a little bit about diseases of the digestive system. Would you like to hear some? I'm Dr. Michael Berglund, and I'm here to talk to you today about digestive problems, specifically gallbladder problems. The gallbladder, for those of you that don't know, is a little muscular sac that sits up right underneath your liver. Now, for those of you who don't know where your liver is, that wasn't very helpful, was it? Your liver is tucked underneath your rib cage. The liver and the gallbladder team up. The liver is responsible for making bile. The purpose of the gallbladder is to store bile. Bile is that solution which helps make water-soluble things and fat-soluble things mix together. So when water and oil separate, we need that stuff to be not separated. The intestines do not like when oil and water separate because, I don't know, they just don't like it. What it means when they don't like it? Bloating, gas, diarrhea. Ew. No. I'd say that means they doesn't like it. The question many of you are asking is, why do gallstones and gallbladder problems happen? That's a very good question. I feel like Mr. Science here. Again, that little gallbladder, that sac, that muscular sac, the bile in there gets thick and sludgy. The thickness and the sludginess, if left there, will continue on to form stones. Stones, like I have stones in my body. You've heard of kidney stones, right? Kidney stones happen because two materials cling together, you're not drinking a lot of water, and therefore the water's staying in the kidneys longer, and these things start accumulating and form a little, almost like a little coral piece, which is obviously bad to try and excrete little coral pieces. The same thing happens in the gallbladder, except it forms little greenish brown stones. Now obviously we've got a little tube, a little what they call duct, coming out of the gallbladder. It merges with the liver's duct, and it forms a common bile duct that goes into the sphincter. Don't laugh, I said sphincter. That's not funny. The sphincter, though, is part of the small intestine, and that juices then flow into that area. If this is thick and sludgy, if this is like molasses up here, and not like water, and this squeezes, nothing happens, and guess what? The intestines are very unhappy. The answer is actually diet. Most cases that I've seen, it's white sugar, white flour, which is actually most wheat flours, and high fructose corn syrup, which we can also include Karo corn syrup into that mix. People that overdo these things will eventually cause sludginess in that gallbladder. The medical system has two solutions. One, live with it. Two, surgery. By the way, that's two. They have two different things, and that's it. The right way to go about things is to start from a very conservative point. Okay, that point which says very little wrong can happen here. An example would be chiropractic, or diet changes, or a massage. These things have a very low risk, and some is a high reward. Then we go the next step over, which is a little more invasive. Some of these may be pharmaceutical drugs, right? Where they can create problems, but they're not maybe going to mess you up for a long time. The last step you want to do, is have surgical intervention. Why is that? Because it's irreversible. You can't go back and say, well, let me try acupuncture now. And if there's still a problem after that, or it's set up a whole new set of problems, now we have to deal with that. We can't reverse that. So start conservative and work your way to aggressive. That's the problem with the medical model. And the medical model right now says, if you have a bad gallbladder, we're going to do surgery. Well, that's all there is, isn't there? They talk about a variety of different things that you can do to fix the gallbladder. There's 3-day flushes, 5-day flushes, and 7-day flushes. I personally like the 7-day flush because it's more thorough. The idea is you're trying to dissolve your own stones, those things that are making your gallbladder not function very well. We dissolve the stones and help your body release them. What I try and do is use things that are known to thin the juices in the gallbladder. So one of the products that I use in my office is called beta-TCP. The other product that I use is called liquid iodine. A product that I sometimes use is a product from Apex Energetics called Gallbladder Terrain. And the combination of 1, 2, or all 3 of those products tends to be very effective in taking that sludginess and helping it liquefy. So the next question is, why tell me all this stuff? I'm a big believer that you should have choices. I believe we should have choices when it comes to what kind of phone I want, what kind of computer I want, what kind of food do I want to eat. I think you should have a choice when you say, well, I have this problem, how can I fix it? And I don't believe in the paradigm that says, well, you're fatally flawed and we have to remove parts. I believe in restoration. I believe you have the ability to fix you. And you may need some help. You need to find doctors in your area or find people that can help you do it, but I believe you can, and I believe this problem is fixable.